crazy. Doesn't matter where you are. It just seems that like it's been crazy,
Doing its
right?
own thing.
Doing its own thing. Yeah. So welcome to week 5.
Think
Um, we're almost halfway there. Next week is week 6, halfway there. How's everybody doing? Keeping up with everything? Schedules are full with assignments and exams and review dates and
Yeah.
right?
I don't know if fool is the word. It's beyond fool.
Beyond full. That's a good way.
Overload.
Overload. That's a great way to describe it. Great way to describe it. So here's what I'd like to do today. We'll go ahead and take quiz 3. And then before we review the quiz, I'll go over some housekeeping items. I want to review the announcement I sent. Has some important things in there, and I want to mention a few things. And then we will review content from weeks 4 and 5, since last week you were taking an exam.
I have
Okay,
a question
all
about
right.
the announcement. Like,
Yeah.
if you don't, or do you want me to wait? Okay. So, our group had like the big Kaplan test the last, or thing the last 2 days. So I haven't really been looking a lot. So today I went in and tried to do the Kahoot,
Okay.
but it wouldn't. It was only showing me like the podium, like the result. Is it because it was already closed out, or I don't know if there was a problem with it, or
Um, shouldn't
if it
be
was
closed
just me?
out.
Okay.
Has anybody else been able to do the Kahoot that I sent in the announcement or tried to do it?
I haven't been able to do it either.
Pardon me?
It just says see podium.
Yeah.
Okay.
It's just like the results. I
Okay.
thought maybe I missed the time frame.
Well, you can't get into it.
Okay. I will take a look at that and I will resend that when I
Thanks.
send the recording. How's that?
Good. I just want some extra practice.
Yeah.
I appreciate it.
Yeah. Yeah. Thanks for mentioning that. Thanks for
You're
mentioning
welcome.
that. Um, let's see. Okay, so go ahead and pardon me, you can start on quiz 3. The access code is my last name. I'll put it in the chat. Um, go ahead and take that. We have, I
Our
think it's,
quiz is long.
excuse me,
It's locked.
it's still locked?
Yes, ma'am.
Mm,
You have to put the access code in.
yeah, you have
Yeah,
to put
it's
the,
locked.
Yeah. I
It
just
says it's
refreshed.
locked until 1:30 p.m., which I assume is 4:30. It
oh,
doesn't. There's mine still says locked.
Yeah, the
My
assignment due date or whatever like that
Mine
allows
just
you to
let me
unlock
in.
it. You said that we were gonna go over some information first because we had our exam last week. So you told us to wait to take the quiz and the announcement.
well, we take the quiz at the beginning of class.
Mine is working. Like I'm in the quiz right now.
Yeah, everybody should be able to access the quiz right now, refresh it. It
Yeah,
was,
mine's not working. I'll try again though.
yeah, it was open at
Mine
4
isn't
o'clock.
working also.
Okay, hang on, everybody. It should have been open at 4 o'clock with the access code, and we have till 4:30 to take it.
Mine's is
So,
still locked. I just refreshed it.
Yeah, mine says locked until May 10th at 1:30 p.m., which I assume means 4:30
okay,
p.m.
let me go in. Hang on, everybody, hang on.
Mine is locked as well.
Okay, all right, 1 second.
I'm
Mine
ready.
Okay.
as well.
Hang on.
Anybody who can get in, the code is Marvel, her last name.
Mm-hmm. Yep, 1 second. Let me just double check my settings here. Okay. Oh, okay, hang on. Yep. Okay. I had it open at 4:30, so 1 second.
It's working. Thank you.
I got it. Can we go ahead and start?
Yeah, 1 second. Let me just make sure. Yeah, everybody should be okay now. Yes, go ahead and get started. The access code. Sorry, one of the sections I had open at 1:30 or 4:30. Sorry about that. Everybody should be able to do it. So we'll come back. It is 4:08. We'll be back. We'll start back at 4:30. How's that? Okay. All right. I'm going to mute everybody and mute myself. Hi,
Yes,
tonight. Can you hear me? Hi.
yes,
Are you in the car?
I am.
You can't. Yeah.
No, I can't, but I emailed you. My car got stolen last night. This is actually not my car. I'm in a different car.
Oh,
But I emailed you because I tried to get a classmate to bring me my laptop.
okay. Oh, I'm
So
sorry. Are you
yeah,
okay? Are you safe?
yeah, I'm trying to figure everything out, but
Okay.
you know,
Okay. All right. All right. Go ahead. I'm sorry. I'm going to close our room, go back into the main room. I'm sorry. I didn't know that. I didn't. I've been busy preparing for class, so I didn't see your email. Okay, it looks like we just have one or two more students, or one more student to finish up. Okay. All right, looks like everybody's done. So if everybody could start coming back on camera, that'd be great. How'd you do?
I got a question, Miss Moore.
Pardon me?
I got a question.
You bet.
Okay, about the quiz. Is that okay?
I'm sorry?
It's about the quiz. Is that okay?
Is it about a particular question?
Yes.
Yeah, let's wait till we get to that question. How's that?
All right.
Okay. So you just, who was that was talking?
Christian.
Okay, so just jump in when we get to the question, okay?
Okay.
All righty. Okay, before we review the quiz, I want to share my screen and go through a couple of things. First of all, let's see. We are going to cover week 4 and 5 since last week was the exam. So congratulations to everybody who passed the exam. I know some of you had scores that you weren't happy with. I've already had numerous meetings with students this week to do exam 1 review, talk about strategies and concepts that you may have struggled with. So if you've met with me, thank you. I appreciate that. If you have a scheduled meeting with me, thank you for doing that. There are still some students that score below a 78 that I still haven't heard from, that I would really like to hear from and set up a tutoring session. Okay, so you know who you are. But for all of you that passed the exam, congratulations. Exam 1 is not a real easy exam. It's covers a lot of material, and plus it's the first exam in this community class. So that's that for the exam. Next week is week 6, which means a couple of things. One is that is a review week, right? Your second exam is 2 weeks from today. Okay, so next week we have review sessions. We have 3 different review sessions: Monday, Friday, and Sunday. If you can get to one live, that's fantastic. If you can't, then please watch the recordings. You'll get the recordings. Okay. If after you have, like I said before, exam 1, if you've done your due diligence preparing for the exam, watching the recordings, attend reviews, doing your exam 2 study prep guide, taking notes with lecture notes, and you're still having trouble with any of the concepts, please reach out during that week, during week 7, before the exam, to schedule a session with me to review anything you're still unsure about or need clarification about, or any concepts you want to talk about that you feel like you're not understanding fully. Okay, so that's always available. All right, so take advantage of that, please. The other thing is next week, or probably the end of this weekend, Sunday or Monday, I'll be turning on homework grades. Okay, that always happens for week 6 and week 7. Okay, this gives the opportunity for students to see how their homework is impacting their overall grade. Does that make sense? So I will send an email and an announcement out when I've turned the homework grades on, because you will see your grade change, your overall grade. Will either go up if you're, turning in your homework and on time and doing a good job, or if you're not turning in your homework, it will pull your grade down. And the purpose of turning the homework grade is you can see how your homework is affecting your grade in a positive way or a negative way. And obviously the homework grades don't get added in until the end of the term, right? After you take your HESI. And between the quizzes, the 5 quizzes, the 3 exams, and the HESI, and we reviewed this in week 1, you have to have a 78 overall KGA before your homework kicks in, that last 20%, right? So when I turn it on for a week and a half, that gives you an indication. So it's just kind of a good check-in. Does that make sense? Right. So I always get a flurry of emails. My grade changed. Why did it go down? Why did it go up? Well, that's because the homework grades were turned on. But I will give you a heads up. Hopefully Sunday night I'll probably turn them on. And the reason why we keep them on for week 6 and 7 is week 8 is drop week. right? So it gives you a good indication of where you're at. Questions about that? No question. Okay. I wanted to, this is the Kahoot. Is this the Kahoot you're talking about? The week 4 and 5 Kahoot activity? That's not this one?
Yes, ma'am. Yes, ma'am.
That's the one you're talking about.
Yeah, you could, if you want, you could try to click on it. It's like a weird thing. I've never seen it before. It goes to like the ending results rather than like than the thing itself.
Drum
I've never
roll,
seen it.
the results.
Yeah.
Okay, fantastic. I will have a look at that. Okay. How is everybody coming with group projects?
Our group is not doing well.
Why?
Just because it seems like now I just got an email from Katie. It's more or less I think we're having trouble figuring out who's gonna do what, and it's a little bit hard because me and Holly are at one school and the other two students are at another, and we're like we're trying. I mean, we're sending an email now, so maybe it'll change, but
Okay.
it seems we seem to be having a problem coming together. So hopefully that'll change, but
Well,
because I know
everybody,
Katie sent out a group
okay.
email.
So everybody in your groups is within this class today. Okay, so I'm just going to make a blanket statement. It is now the end of week 5. Okay. All emails, initial, hi, I'm in. Do we have to write it out or can I type it in a Word document? What, the project, Kayla?
Yeah, I seen in your message to a written one. Sorry, my son's bothering me. Write it out, but I didn't know if we could put it on a Word doc.
Yeah, it should be on a Word document with a cover page. You know, it's a proper paper. Okay. By this time, everybody, there should be some email swirling around within your group, right? Somebody should have taken the lead at this point to send out, hi, I'm Ryan and I'm Holly. We're in the same group and we need to decide who's going to do what. Okay, so the initial email should have already gone out. By this time, team members should have responded. You guys, your group should have a plan at this point. And like I said, everybody in each group is in this class. All right. So if you haven't responded to your group, I would highly suggest you do it in the next 24 hours. Okay. I know there's people that want to get going early and there's people that want to wait to the last minute. Part of when you're working in a group project is collaboration in a timely manner. Okay. I wouldn't have said this 2 weeks ago, but now being the end of week 5, now I'm going to say it. Okay. If you haven't reached out to if you haven't responded to your group, now is the time to do it. Okay. And get a plan together because you only have another week and a half to do it. And you have to pick your part of the group project. So having said that, what I would encourage you to do, groups, if by Monday, your group doesn't have a plan and you're having trouble getting students to respond to your group, I need somebody from that group to email me. Okay? And then I will reach out to that particular student that's not responding and have a chat. Okay? Does that make sense?
Yeah.
Can you guys chat with each other? You guys can chat with each other within this class, correct? You can send a message to somebody.
We
I
can
did
send
it
a
last
message on
week,
Canvas.
yeah.
So being that like our
Yeah.
group is 2 students
Yeah.
from our campus and 2
Yeah.
students from another, I've not had any issues
Okay.
communicating with them.
Well, and a lot of groups are kind of humming along, right? Doing it. But there are groups that are struggling. So if you're a part of a group that's struggling, everybody's got to get on board. So groups that are having issues with people not responding, I would give the weekend to respond, but by Monday, there's got to be a plan in place for your group. It's just not fair to the rest of the group. Okay? Ryan, does that answer your question? How are you guys coming with your HESI prep? Are you working on it?
Yep.
Because like I said in week 1, if you're waiting till the end, it's going to be a long, hard assignment. If you're waiting till week 9 to get it done. It is long, but guess what? It's what's on the HESI. So it is long, but it's your study guide. So that's why it's given in week 1 to make it a work in progress document through the whole term. Right?
Yeah.
So yes, I get it. It is long. But remember, the HESI is 50 plus questions.
Yep.
Each of those topics represent a question. Okay, so I'm not trying to make extra work for you. I'm actually trying to help. Okay, so yeah, I know it's long. Go ahead.
Yeah, it's very long.
Are we gonna have enough time to go over content today?
Yeah,
If
we
we
do.
are going over this now and the quiz, and we've only got an hour left to class.
Yep. Well, I do a lot of content teaching with the quiz, and then we'll cover after the quiz what I haven't covered. Okay? So let's get to the quiz. Okay, can everybody see my screen? Okay. Okay, so school nurses engaging in a primary prevention program. Which intervention is appropriate? What's the correct answer here?
2.
Right. Discuss how and where to obtain contraception. That's a prevention intervention. Okay, what is A? What is A?
Secondary.
Secondary. What is C?
Tertiary.
Tertiary. Why is it tertiary?
Because it's already have the
You already
We
have.
already have the antibiotics already for treatment.
Well, you already have a condition,
yes.
right? Okay, what's D?
Secondary.
No, that's tertiary because
tertiary.
it's already
Oh,
has
so yeah, B.
also
Secondary.
have the I mean, she's pregnant already.
You're pregnant,
Yeah.
right, Ryan?
Yeah.
So you already have something. Not you don't have something. You're pregnant.
Something's going on.
Now you're managing the pregnancy,
Okay.
right?
Right.
Okay, number 2. Which counseling is appropriate to provide a pregnant adolescent?
Number 1.
1.
Everybody
A.
agree it's number 1.
Yes.
Yeah.
Okay. We know that number 2 is incorrect, right? We need modifications. We know that we want to establish prenatal care in the first trimester, right? And there's no reason for any adoption decisions that need to be made right away. That could be something that's discussed throughout the pregnancy, correct?
Correct.
All right. So if this were an exam question and you were using your little eyeball to cross out answers and read this question, right? You could cross out B, C, and D, and you've come up with one answer that's the correct answer. Does that make sense? I've done a lot of tutoring and reviewing this week, and I can tell you, I really, really encourage what I've told you before. Reading the question that first time around, highlighting anything in the question, and then using that eyeball to cross out any answers. And then the second time you go back to it, it will be much more organized and targeted for you. And this would be a perfect question that you could cross out. You know B's wrong, you know C's wrong, you know D's wrong. So by process of elimination, there's only one answer left and it's the correct answer. Does that make sense? Talked a lot about that this week with students. And what I found this week, meeting with lots and lots of students, it's, for the most part, it is not an issue of, some is preparation, but what I'm finding is slowing down. Students are missing key words in the questions. All right, so this is not a blanket statement to everybody, but take your time and slow down. All the information you need to answer the question is right in the question, okay? Which intervention should be prioritized for a child who has witnessed a violent crime? What's the key word in this question? What are the key, what would you highlight?
Prioritized.
Prioritized. Okay, so you're looking for the best answer, the most important answer. What's the answer?
Obtain referral for mental health.
Exactly. That's what has to be prioritized. It's not to say that A couldn't be correct, B couldn't be correct, D couldn't be correct. Okay. Again, another example of what did you miss? There's more than one answer that looks right. What did you miss? Prioritized. Okay. If C happens first, then we can start to deal with A, B, and D. Correct? So the key word was prioritized. All right. Which nursing intervention reflects secondary prevention for mental health?
Screening for depression and anxiety.
Screening for depression and anxiety.
Right. Screening. Screening is secondary. What's B?
B is tertiary.
Secondary.
No.
You're teaching.
Primary.
Primary. You're
Primary,
teaching
yeah,
stress
prevention.
reduction techniques. There's nothing going on yet. You're trying to do some prevention teaching, right? What about C? What's C?
That's secondary.
That's the
Nope.
Secondary.
Tertiary.
secondary.
Why is it tertiary?
Because
Oh,
that-
because
That's right,
already
'cause it
have
hasn't
it. So
You already have it.
Yeah.
There's a mental health diagnosis going on. It sounds like depression. And so we're observing side effects from medications. They already have something.
that'll be the same for arranging too. That'll be tertiary.
Exactly. Yep. Yep. D is tertiary as well. Okay, which nursing assessment is most important for a client abusing oxycodone? What is
Apnea.
okay? What's the key word in the question?
abusing oxycodone.
Abusing.
Important.
Most important.
Most important. Right? This is an ABC question. You'd be looking for apnea. It's not to say that the others wouldn't be present, but it's asking for the most important side effect. Okay? Which reflects tertiary prevention in substance abuse?
Arranging
addict-led support groups to promote
C.
recovery.
Yep.
Yeah.
Arranging support, right? They already have some kind of substance abuse. So we're trying to manage it, treat it. Okay, what's A?
Secondary.
Screening. What's C? Or excuse me, what's B?
Tertiary.
Mm-mm.
Tertiary.
Primary.
It's
Right? We're providing information regarding substance abuse. It doesn't say they have it. We're trying to educate about substance abuse, right?
What if it said, providing children with information regarding like substance abuse who have like parents who are substance abusers?
Okay, what's the question?
Like, what if it said like educating children who are the children of like substance abusers about substance abuse?
Okay, I thought you're kind of cutting out. I thought you heard heard you say, you know, if the parents have substance abuse, you're educating children about that?
Yeah, yeah. So basically, it'd be the children of substance abusers are getting like info.
But the children don't have anything. I mean, like I said, Ryan, you're breaking up, but it doesn't give you that information that the parents are.
And I was adding to it, like
Yeah, you're adding to it,
Okay.
right? So yeah, you're adding to it. Nowhere does it say that,
Okay.
right? So what B really is providing preventative education. That's what that means.
Okay.
Okay, does that make sense?
Yeah.
Okay. Okay. Which nursing intervention reflects non-malfeasance? What is non-malfeasance?
The
Like,
no harm to self.
Do no harm.
And
Okay, we got
everything else on there is positive or like bad. So the first one would be it.
right. So do no harm. So obtaining a new A is correct. Obtaining a new urinary catheter after you've contaminated the field, right? That is an intervention towards do no harm. Right? The rest of the answers are doing harm. Correct?
Correct.
Beneficence. What's beneficence? That's the other important ethical principle.
Do good.
Ryan, I can't hear you. You're breaking up. Do good.
Yes. Do good.
Right? That might have been what you were trying to say, Ryan.
Yeah.
Do good. Practicing beneficence. These are the two most important: beneficence and non-malfeasance. Do good, do no harm. Okay? Okay. The hospice nurse notes that the client's pain is poorly controlled despite a fentanyl patch and as needed sublingual morphine. Which intervention is appropriate?
Notify the provider.
Okay. What's important in this question?
That
It's
the
a
pain is still
hospice.
not. Yeah.
It's a hospice patient.
So we don't have to worry about no addiction since he's a hospice patient.
Bingo.
And we trying to make him comfortable.
Correct. That's exactly right. All right. So the best answer, notify the healthcare provider for the need for additional pain management. Okay. The other answers are incorrect. Add a non-pharmacological pain management to avoid the risk of addiction. We are not concerned about addiction with hospice patients. And hopefully you pick that up in your reading. Counsel the client and the family that a pain-free death should not be expected. Yes, it should. You know, we are trying to make the client as comfortable as possible. Why is D wrong?
Application.
That's like toxic. That's like an overdose kind of.
Exactly.
Yeah.
Exactly. Okay. The client tells the hospice nurse, I do not understand why God is punishing me. Which is the appropriate response?
This is the one I had a question on because
Okay.
I feel like
you call a pastor.
Hang on. Christian, go ahead.
It's kind of contradicting to me because we've been learning, well, what I've learned is you have to have like a therapeutic response. And to me, you know, we don't know about this client, like about their religious thing. So I wouldn't say, let me pray with you for forgiveness. That seems kind of judgy too. And then it's like, again, the two seem like the cultural thing, like preferences. We don't know that. And then it's just like the dying is just a part of life, like not punishing. That seemed kind of like not therapeutic and kind of mean and kind of like judgy. And then I thought you're supposed to re-ask a question, like keep it open-ended. Yes. So that's why I picked what makes you think you are being punished, and I got that wrong.
Right.
Yeah.
Yeah.
Well, when I read into the thing, on the little PowerPoint thing that you read, just on that part, it said to call a pastor. It told you to go into the history of the past, present, and future of what his religion or spiritual background was.
Right.
So that will be
yes. Thanks, Marquita. So that's my answer as to why why B is correct in this. I understand that, well, we're not going to say, let me pray with you for forgiveness, right? Dying is just a normal part of life. We're not going to say that. What makes you think you're being punished? As hospice nurses, even though they have additional education, they always aren't prepared to answer the deep religious questions. Okay. And that's why we will always, or more often than not, say, is there, I'm sorry? Go ahead. Did somebody have something? Go ahead. Did somebody have something to say?
I just wanted to add, Professor Marvel, that last answer, well, and then, for instance, privacy boundaries, no matter what, even if the person has a confession to make.
Exactly.
I don't think he's going to start telling you all the bad things he's done in his life.
That's exactly right. And so asking D to them, you're inviting them to communicate to you some things that we don't really, it's really none of our business.
Exactly.
Right? We don't want to incite any more pain or suffering. We're acknowledging that they must have done something wrong by asking them what they did that they feel like they're being punished. Right, Molly?
That's right.
Yeah. So the best answer for a hospice patient, especially if we're talking religion, would be asking to call a pastor.
Yeah, see, well, I didn't get, apparently me and other people, like, we thought the same thing, and I looked at the slides and stuff, which they were only videos, so I guess I was just going back on what I've been told, like I said, so that kind of just threw me off, I guess.
And to piggyback off of what Christian is saying, who are we to assume that it's a pastor just because they said God? That's what had me very confused. And I probably reading into it too much. And that's part of my issue is that I overthink it. But for the patient to say a statement, I do not understand why God is punishing me. And for me as a nurse to cut it off, do you have a pastor I could call? That's how I'm thinking in my head realistically. What if it's not a pastor? What if it's Allah? What if it's something else? We don't know. That one was just confusing.
And I feel like that
with that too,
typically you
I
get
feel
the
like
patient's
it's a
religious
dismissive
affiliation
type
on
of
your
response.
Go ahead, Kara.
I feel like that's a dismissive type of response to just.
And Kara, she works
they're
for
upset.
hospice, so.
Yeah, I worked for the hospice, and I even I would never say that even for hospice. I would still go with the open-ended because I just feel like the second answer is very dismissive to how they're feeling because you're just automatically ignoring what they said and can I call a pastor for you?
Okay.
It is. It's very dismissive, to be honest. But just in the book, in the reading, it says.
I read everything, and
I thought twice.
Apparently.
Yeah, I remember seeing that part specifically. It was at the end, and it was like, call the pastor. It said it.
It certainly isn't. It's not meant to be dismissive. It's meant to get them whatever help they need to answer that question. Are we all prepared to? Can you answer that question for the client?
No, but it's just the way that a lot of people, it seems like this in this or this on here has been raised and how they carried on.
Exactly.
I would think this to say, do you have a pastor to call? It's like I'm saying I don't want to deal with it. Let me find somebody else. That's what we're saying. Like it do seem like that. Now, I know the books say different, but I'm just saying like just your moral ethics.
Yeah, I understand.
I wouldn't say this to nobody.
Okay.
Exactly. Me neither.
Even if you're not prepared to deal with it at hand too, like even if you don't have the answer like right away, if they give you like a crazy situation, then you can offer after the fact, after they speak up and say like this is what's bothering me or this is yada yada yada, and you can be like, okay, well I can't help you in that area, but I know somebody who could, or would you like if I get somebody who can help you in that area?
Right.
Yeah, that question is kind of crazy. I feel like that should be a.
All right. I appreciate as good discussion. The discussion always comes up with this question. For purposes of this class and your reading, B was the correct answer. And I know there's a lot of discussion around it. And like Callie just said, they've already said something. They've already, like Callie said, let them say what they want to say. They've said, I don't understand why God is punishing me. And so if you're not prepared to answer that question, then the best resource for them would be talking to a spiritual person. Okay.
What if he tells you something you really didn't want to hear and it becomes legal?
Pardon me?
What if he tells you something you really shouldn't have heard? Are you going to report it? If he says, well, I murdered somebody 20 years ago. Now what?
Yeah. You could, there's a lot of things to think about with this question, right? Let's finish up. A client with metastatic cancer has made the decision to stop all cancer therapies. Which statement by the nurse reflects the respect, a respect for the client's autonomy?
A. With A.
I put A. A, right? B, C, and D are not correct answers. They've already said they don't want any more treatments, so we would not want to be talking to them about radiation. Same with D, we would not want to be talking to them about chemotherapy, right? And C implies that we're questioning their judgment, right? Okay, can everybody see my screen still? Okay, let's talk about some special vulnerable populations. Pregnant adolescents, what challenges do pregnant teens face?
Getting the proper care,
like their nutrition.
Nutrition?
Lack of
Lack
like
of
social
knowledge.
support.
What was that?
High stress levels, like anxiety and stuff like that.
Finishing school is could be a challenge for them.
Finishing school.
Their body
and
appearance.
social support. Oh, sorry.
Social support.
Appearance.
Denial.
Lack of resources.
Late prenatal care. Right? We know the teens are, I'm reading from my notes here too, teens are nearly 3 times more likely to drop out of school. So if you're working with teens, we want to try and keep them in school during their pregnancy and after their pregnancy. Okay? We know that a better education, a longer education for them gives them a better chance at a better outcome for both them and the baby. Okay? Pregnant teens are much more at risk for certain things. Violence in their pregnancies, substance abuse in their pregnancies, poor nutritional status we talked about, and obviously a higher incidence of poor birth outcomes. And then what about the pregnant homeless teen? Somebody needs to, if somebody could mute that has all the background noise, that would be great. Pregnant homeless teens is another big issue. Much higher rates of STDs, drugs, alcohol, again, poor nutrition. And much more at risk for poor birth outcomes. We know that racial and ethnic minority groups have higher rates of teen pregnancy. I'm filling in your gaps here on your PowerPoint. Domestic violence increases with homeless pregnant teens. Okay. One of the things that if you're working with homeless pregnant teens, is establishing safety plans. What's a safety plan? And why would they need that?
Somewhere to go, someone to call if something happens, maybe.
Yes.
Yeah.
Yep.
So like if they're living with a boyfriend or if with an unstable parent and out, or if they get hit or they They encounter, that's the word I was looking for, violence.
Yeah. In addition to what you just said, here's what our notes say: a bag of clothes, important documents, having some money, maybe a credit card that can't be traced, spare car keys, phone numbers for shelters and resources. And in your readings, there was a link to the National Center for Domestic Violence for additional resources. Let's talk about postpartum for a minute. Let's say you're the home health nurse and you're doing postpartum visits for a new mom, a new teen mom. What do you want? What would you like to see? Or what are you going to be assessing when you're doing those visits?
Bonding.
Bonding. What is positive bond? What do you want to see that teen doing?
Holding her baby, interacting with
the baby.
Okay. Baby's crying, want to be able to identify what issues there are, what's going on. Right? We want the teens to have a sense of what is normal growth and development of their baby. What are milestones? Right? That's the primary goal. Right? Teen mothers do struggle with bonding. Okay, do they hold the baby? Do they change the baby? Do they feed the baby? What is the environment like? Is it a healthy environment or an unhealthy environment? Is it chaotic? Is it calm? Is there support there? Is there not support there? Are there signs of neglect? Is the father around? What does that relationship look like? Is it supportive or not supportive? Okay. Okay, let's talk about our LGBTQ population. What is the first thing that I'm going to tell you what the first thing is. And this comes with all vulnerable populations. One of the first things that we have to do as nurses in caring for these most vulnerable populations is check our own feelings, right? We need to check out where we're at. Do we have any prejudices? Do we have any biases? Do we have any thoughts that would prevent us from competently caring for vulnerable populations, including, go ahead.
I said, if you do, you can leave them at the door.
Exactly. That's what I'm getting at. We have to be able to check our own feelings, because if we can't competently and openly care for homelessness, LGBTQ, pregnant teens, we're not going to be able to provide competent and adequate care. So we always first need to check our feelings first. And that's what this second bullet is: understanding our own feelings. Okay. When working with the LGBTQ in particular, we have to be able to provide them a safe environment for us to be able to do an assessment of sexual desires, sexual needs, sexual preferences, right? Whatever. I mean, asking open-ended questions to somebody who's LGBTQ, maybe not, do you have a boyfriend? Do you have a girlfriend? Maybe do you have a partner? Okay, we have to be able to approach and ask questions in a compassionate, non-judgmental way, right? We can't make assumptions, right? We can't make assumptions based on appearance or sexual behavior. We open-ended questions. We talked about this. Are you in a relationship? Maybe asking, are you in a relationship? What do you call your partner? Right? These allow us the opportunity for them to open up. Right? We can't assume heterosexuality. Okay. CDC recommendations. Okay. There's CDC recommendations that are annual for this particular population. Okay. And they're listed right here. Okay. We screen for HIV, genital herpes, gonorrhea, syphilis, and chlamydia. Okay. Those are annual screenings. If the client is considered high risk, then that interval shortens up to every 3 to 6 months. Okay. There's two high risk indicators. All right. There are individuals with multiple and anonymous sexual partners, and those who may be using illicit drugs along with sex. So I'm filling in this last bullet for you. What are the screening intervals? So annual for these 5, and then bumps up to 3 to 6 months. So that's really all I want you to know about this population is how to approach them, how to open up a therapeutic conversation, non-judgmental, because they also need to be able to feel safe in communicating whatever their health issues are without being judged. Okay.
You said annual screening, and then after that first year is 3 to 6 months screening after that?
No, annual screening is for those 5 conditions. That interval gets moved up to every 3 to 6 months if they have those additional high risk factors.
If they're more promiscuous.
Okay.
Thank you, Kelly.
Multiple partners. Okay.
Okay, mental illness. There's a lot of mental illness going around. Okay. Anxiety, general anxiety disorder is very common. Okay. Anxiety is an expected common emotion that's considered normal and healthy unless it becomes too debilitating and it impacts our daily life. Okay. It's estimated that 30% of mental illnesses are somehow genetic, meaning there's a family history. Okay. General anxiety disorder is the most common. What is what are some symptoms? What are some symptoms of general anxiety disorder?
Worry,
Anxious?
nervousness.
Anxious?
Anxious about a lot of things over a long period of time.
Yes.
Right?
Mm-hmm.
That's what general anxiety disorder is.
Oh, we all have
okay. Person experiences persistent, unrealistic, or excessive worry about, this is the definition, about 2 or more life circumstances for 6 months or longer. Okay, then we have phobias. Excessive irrational fear of something, a situation, an activity, an object. Okay, this leads to extreme anxiety. Then we have OCD. Okay, obsession, recurrent, intrusive thoughts that you just can't stop thinking about. And there's some mental illness questions on the next exam. It gives you scenarios of what patients are presenting with, and you have to be able to determine, is it a general anxiety disorder? Is it a client with OCD? Is it a client with PTSD? That's why I'm going through some of these definitions. PTSD, a previous event that involved serious threat, serious injury, in which you still have intense fear about, right? Helplessness, right? The recurrence of it, the thinking of it. And then suicidal ideations is another one. When you're caring for a client with suicidal ideations, the priority is safety, right? We need to ask those clients with the suicidal ideations, do you have a plan? What is your plan? Do you have the means to carry out your plan? Have you attempted suicide previously? Those are all important questions. We know that kids are at very high risk for mental illness, right? Maybe due to adverse circumstances in their family, in their school.
Like lack of control or something. Maybe they feel like helpless or something.
Helpless, hopeless. Maybe they're a death in the family, divorce. Maybe they're living in poverty. Okay, but kids are very, very high risk for mental illness, right? Maybe they're being victimized themselves. Maybe they're being abused. Though there's been an exponential increase in mental health issues with children ever since the pandemic. And pardon me, that is well documented. Okay. One of the drugs that I would like for you to know about is lithium. Okay. What mental disorder is lithium typically used for? Bipolar. So let's assume we're teaching a client that is starting on lithium. What do we want to teach them? I've listed the 3 important points here. Encourage normal salt intake, report diarrhea, report vomiting, tremors, and lack of coordination.
Those are signs of lithium toxicity, right? So is that
They
why?
can be, but that's what we want to teach them about. Right?
Shouldn't you get a lab drawn like every now and then because you're on lithium?
Yes.
Screening, yeah, absolutely. I don't know what the intervals of the labs are, but yes, you'll periodically be screened for your levels to make sure you don't have any kind of toxicity.
It depends on your dose.
Yeah.
It depends on the dose. We usually do it every 90 days in my clinic.
Every what?
90 days.
Every 90 days.
90 days. Okay.
Yeah. I know some people get it sooner, some people get it later. It really depends on your dose and your doctor.
Right. And if you're changing doses, let's say it's the dose you're on is not working and they want to increase your dose, I'm sure they're going to do a level. Right? Alcohol, tobacco, and other drug problems. All right. We know that substance abuse contributes to a lot of this is just a minor list. Contributes to teen pregnancies, STI, STDs, domestic violence. What else does alcohol and drug problems, what else does it contribute to? Violence. Go ahead.
I said cirrhosis of the liver.
Cirrhosis has physiological issues, psychological issues.
Yeah. It also leave you with like no support because usually they don't want to be seen by their family like that. So that's what draw them out to the world of homelessness and
Yep. So and there are people that are predisposed to alcoholism or substance abuse, right? Just simply by their heredity, right? Couple of things I want you to know about alcohol, tobacco, and other drugs is some definitions. These are in your readings. Know the difference between substance abuse. Write this down. Substance abuse, drug dependence. This is right from your readings. Drug addiction and polysubstance abuse. What's polysubstance abuse? What does poly mean?
Many is poly means many.
Many.
Multiple drug use.
Yep.
I always think of that like a poly relationship or something.
That's a good way to remember it. What about tobacco? What are the issues with tobacco?
Cancer.
Chest problems.
Respiratory
cancer.
Respiratory problem.
Okay. What about vaping and e-cigarettes? What's wrong with that?
It's the same as tobacco.
It's the same.
Collapsed lungs. That's very popular where people are getting collapsed lungs from that.
Well, for vaping, lung damage, they're very appealing to youth with the vaping and the e-cigarettes, right? But what about that oil in the vape? What is that? What's the problem with that? It's poisonous to kids, right?
Yeah, it's killing them.
Yeah. So we have issues with alcohol. One of the things I want you to be able, you need to look up or review your reading. I want you to be able to identify a patient presenting with cocaine toxicity, amphetamine toxicity, and alcohol toxicity. You're going to be asked a few scenarios in the next exam. You have to identify, is this a cocaine toxicity? Is this an amphetamine toxicity? There's a lot of similarities, but there's a couple of pretty big differences.
Professor, can you?
I have one question.
I missed one.
For the substance abuse, you said substance abuse, drug addiction, polysubstance abuse, and what was the fourth one?
Alcoholism.
Alcoholism. Yep. Yep. So cocaine toxicity, amphetamine toxicity, it's all in your reading. I'm just asking you to review it. What do we think of the contributing factors to substance abuse?
Poverty.
Poverty.
A person's environment.
Environment.
Mental health issues.
I was
Mental-
going with health. Yeah.
Mental health issues. What else?
Also being a victim, like trauma.
Trauma. Peer
Like,
pressure.
Hope.
Yep.
Yeah.
Peer pressure. Let's talk about a few things that the community can do since we're community nurses. And what can we do in the community? Oh, I'm sorry, I should have jumped to this. Terms. Here's your terms that I want you to know about. Substance, drug dependence, what's withdrawal, drug addiction, polysubstance, and alcoholism. So that's on your slide. Psychoactive drugs and specific, I really do want you to know, what does a depressant do? What does a stimulant do? Well, nothing elaborate. Just understand what depressants do. What does a stimulant do? What does an energy drink do? What does using nicotine do? Vaping, alcohol, cocaine, and amphetamines.
Like what it does to the brain, to the body.
Or
more like what their signs will show if they're overdosing on it.
Both. Why would you use antidepressants, and how would a patient present to you?
Like if you
were
don't for an antidepressant, like it's going to increase your serotonin.
Exactly.
Or like your norepinephrine, like because certain antidepressants, like there's antidepressants that increase serotonin, but there's also antidepressants that increase norepinephrine.
I would like for you to know what the effects are of each of these. So if you're presented a scenario, that's where I said cocaine overdosing, amphetamine overdosing, alcohol toxicity. Think clinical.
So when you mean depressants, you don't mean like an opioid, which depresses your system. You mean like clinical, like medications are given, or both?
Both.
Okay.
Yeah, both. Okay. Community-based activities. If we're a community nurse, here's some suggestions. So any kind of school activities. I did a lot of teaching in the schools about substance abuse prevention, from middle school all the way up to high school. Student assistance programs, if we screen students that may be at risk, what are some programs we can get them involved in? I also did a lot of teaching with parents, parental awareness. How do you recognize if your kid maybe has a problem or is dabbling in certain drugs?
Their behaviors at school, or even like at home.
Mm-hmm.
Like you'll see like the difference if they start like showing signs of depression, like go from happy or
right,
and then they just start like being mean or being sad or just acting out.
Yep. Talking to parents about not allowing underage drinking in their home. Teaching kids about anti-peer pressure skills. And then we talked about the secondary, the screenings in the schools, behavioral health screenings, substance abuse screenings. Who's at risk? Okay. Let's jump to this week. This week was some of your quiz questions about hospice and palliative care, death and dying, faith and spirituality, ethics, and what is the American Nurses Association. So let's start with hospice and palliative care. Okay, what's the difference? What's palliative care is from when you're diagnosed. Let's say I was diagnosed and I have a year to live. That's what the expected time is. Palliative care is the care during that time, right? Trying to improve the quality of life, trying to alleviate suffering, trying to make the most of the time you have left. That's all about palliative care. Once they go into hospice care, that's the imminent death phase, right? Maybe they have 6 months to live if all treatments are stopped. Okay, where we're not worrying about, that was a quiz question. We're not worrying about addiction. Okay, we're focused on keeping the client comfortable, maintaining dignity and self-esteem. Right? Although we need to control the pain for our hospice patients, we don't want the patients so out of it that, excuse me, they can't communicate with their families or participate in the decision making of what they want done. Right? We don't want them so sedated they can't participate, because part of hospice care includes as much autonomy as we can provide, meaning we want the patient and or the family included in the plan of care. Okay, we know that family care is also important with hospice clients, but you have to remember that the client's priorities are what we need to prioritize, right? When you're caring for a family, we need to think about stages of grief if they have a family member in hospice. I want you to review from your readings the stages of grief and be able to identify a family scenario in which one child is thinking this or saying this, the other child's saying that. They're all in different stages of grief. And how do we work with the different stages of grief with different family members? Okay? Using therapeutic communication, open-ended questions. Pain control, we're not worrying about addiction. Right? Maybe we're giving pharmacological and non-pharmacological meds for pain management. Okay, we talked about the palliative care. Okay, let me ask you a few questions. What is, where is it? What do you expect to see with clients at the end? Has anybody worked with end-of-life clients? What do you expect to see?
Acceptance, maybe, that they know they're dying.
Mm-hmm. Right?
Sometimes you see fear.
Fear? What kinds of physical symptoms might you see towards the end? What's the body doing?
It's modeling. On the fingertips, you really can tell. Their lips sometimes change colors depending on the skin color.
What about their breathing?
Shallow.
Is that the Cheyenne strokes?
Yes, that's what I'm getting at. Yes.
Change strokes.
Yep.
Yeah, the change, whatever.
Hospice care is hard. Okay, it can be mentally draining for the family, for the patient, but for the caregiver. Right? So hospice care needs to encompass everybody. Right? And again, we go back to the ethical principle. We need to make sure, I had an experience with my husband's mom last summer, where she was towards the end of life and was on morphine. Well, it wasn't doing much for her. Unfortunately, she was being cared for in her home by a certain group of home health aides that had a certain culture, from a certain culture that had the belief of not over medicating. So they wouldn't follow the doctor's orders for the medication.
It's crazy.
I know, but it's culture. It was a cultural belief. So we had to shift and find a whole new set of caregivers towards the end.
Yeah, and some people and families know too. I know, what is that Roxanol? Everybody be like, oh, it gives the death rattle, and it kind of like speeds the death. So a lot of people be scared to use it because it got a real bad rep.
Right.
So people don't.
Right. Faith and spirituality and culture. Okay, what's cultural competence? What's cultural competence?
Isn't that like getting to know, like they're being knowledgeable about their culture and their spirits and beliefs and stuff?
That's for us. Our culture, our cultural competence as nurses means that we can treat every person as a unique individual. We don't have any biases about their culture or their values or their beliefs or their practices. We are able to we learn about cultures, which is a lifelong process as nurses, right? We're always going to be working with different cultures. But cultural competence means that we can competently care for clients and incorporate as much of their values and beliefs, practices, food preferences, care preferences, visitor preferences. The goal is to incorporate as much of their cultural beliefs into their plan of care. Right? So us being culturally competent nurses means we need to know about the culture, know about their practices. Right? If we don't know, ask. Certain cultures love to talk about their beliefs and practices. How can we incorporate that into your plan? Right? Some examples, Native Americans do not like sustained eye contact. I'm just giving you some examples. Okay, what about Jehovah's Witnesses if you're taking care of them? They're not opposed to surgery, but they are opposed to blood transfusions. Mm-hmm. Jewish clients who follow the kosher diet. Maybe Muslim clients who have strict visitation policies, who can care for their loved one. Right? So it's knowing, it's being aware. And I was exposed to many, many different cultures in the schools. Each of our little school communities had different populations of different cultures. And how that transcended into the school and the caring of the kids in the school. We can't assume, we can't make that assumption that don't treat patients as you would like to be treated, because each culture is vastly different. Right? So this last bullet is really important here. Cultural competence is attained when the nurse makes a conscious attempt to learn about other people's diverse cultures, and we're able to look at the world through their perspective. Okay? We're in cultural knowledge, cultural competency is an ongoing process for us through our whole careers. Part of another community role is a faith community nurse. We've talked about the school nurse. We've talked about the occupational nurse. We've talked about the lots of different roles. Well, what is another role as a faith community nurse? Right? Where they may be part of a congregation or an organization for whatever religion, if it's in a mosque, if it's in a temple, if it's in a church. But there is a role called the parish nurse, faith community nurse. And they do everything nurses do outside the congregation, but they add the spiritual dimension to the care, incorporating spirituality into their plans. All right, they really focus on holistic body, mind, spirit. I have two friends who are faith community nurses, been doing it for years, and that's what they bring to their visits in their congregation is the spiritual part, whatever the religion is. And here's a little bit more about what I just said. There's two definitions: religiosity and spirituality. Okay, the two differences. Religion, we're talking specifically about a single religion or denomination, where spirituality is the big picture. What are your attitudes? What are your congregation's attitudes related to the higher power? So know the difference between religion and spirituality. Religion is specific, spirituality is looking at the big picture. And for a lot of people, religion and spirituality helps people through their hard times. That's why you had that quiz question. Okay, how do we incorporate religion, spirituality into patient care? Kind of like culture, we ask. You know, if you're in the hospital, nurses will always ask clients, do you want me to call a spiritual advisor? Do you want me to call a chaplain? Do you want to speak with a chaplain, spiritual advisor? Ethics. Ethics is one of the foundations of our practice. Think of all we face ethical issues every day, whether it's family, work, school. We're always facing ethical issues, all right? Ethical decision making is complex. All right. Ethical theories and principles. What I want you to know is non-malfeasance, beneficence, do good, non-malfeasance, do no harm, autonomy. What's autonomy? Letting people make their own decisions or involving them as much as we can. Moral distress. All ethical issues. You know, what's ethics? Ethics is morals. Ethics is doing the right thing. Advocacy. Another one of our ethical principles. We are advocates for our clients. We're advocates for our kids. We're advocates for our family. We're advocates for our patients. Autonomy. We want them involved. We talked about non-malfeasance. Utilitarianism. That's a decision-making model. Utilitarianism. I want you to know about utilitarianism and virtue ethics. Okay? Utilitarianism is focused on the outcomes. All right? So you're focused on, you're trying to achieve the outcome that produces the greatest amount of good with the least amount of harm. And then virtue ethics. Virtue ethics is based on character. Character virtues, right? Trustworthiness, compassion, integrity. Ethics is the foundation of our practice. Okay. American Nurses Association, what I want you to know about them. Okay. They represent all nurses in the country. They formulate general standards, general guidelines for nursing practice. They're broad in general. Okay. The Nurse Practice Act. I think that's our last. Nurse Practice Act is to protect our patients. It's about practice. We all have to have certain competencies, certain skills to be competent for our licensure. The Nurse Practice Act is set out to protect the public from incompetent caregivers. And then the American Nurses Association, they represent all of us. So they're general standards and guidelines for nursing practice. And then the states involved will look at the scopes of practice with each of the groups, physicians, nurses, RNs, LPNs, aides, therapists. Okay. And my notes that I'm reading from are coming from your readings. All right, I'm just trying to fill in these gaps on the PowerPoint because PowerPoints are outlines, right? You should be able to fill in those gaps of your outline with your reading and with the lecture. Does that help?
Yes, it does.
You know, we covered a lot today. So what I would do is go back to your study guide that you got in week 4, because we've covered week 4 and week 5 today. Okay. You should be able to, all the concepts that we covered are listed. So hopefully you're taking notes on these concepts. And if you're taking them in the study guide, then you're one step ahead. And then next week, we'll cover the last concepts before exam 2. Okay. And then in my reviews, in our reviews, we're even more focused. We're getting towards the meat of the exam, right? What you need to know for the exam. Or what's important to know, what information about each concept is important to know to be able to apply to clinical practice for the exam. Because the exam, once again, is clinically focused, right? Taking your knowledge and applying it. Okay. I have 6 messages in the chat. Oh, okay. Nothing I need to answer right now. So, that's it for today. Does anybody have any general questions that will benefit everybody? And if you don't, you're free to go. If you would like to, oh, go ahead. Go ahead, Marquita.
Sorry. No, that was Christian.
Oh, go ahead, Christian.
Sorry. I don't know if you mentioned this already. As far as the HESI assignments, what are you, I mean, I read it, but like, could you, like, what are you expecting? Like, do we write questions? I just want to make sure I'm writing the right thing, like, because I never did this before, so.
Okay, so in the directions, it asks you to think about the nursing process.
The ADPI, yes.
The ADPI. So I would look at that, look at those, each of those topics as if you were caring for a client or you were preparing a program in the education part.
Okay.
What might that client present with? I think the first box is anthrax. What do we want to know about anthrax? Well, if you're going through the nursing process, your ADPI, what may they present? What may they present with? What treatments are there? Is it contagious? How do you protect the public? Thinking through somebody showing up at your urgent care or your office building or wherever you are, your emergency room with a potential anthrax exposure. I don't need to know the definition of anthrax. You should already know that. What you need to know is how you would care for somebody exposed to anthrax.
Okay.
Does that make sense?
Yeah, so it's kind of like, okay, like a teacher plan, like how we've been doing, like with the stuff, like what do we do as a, like,
exactly.
You know, if we was in a community, like what are we going to do? What are we going to teach about it, look for and stuff? Okay.
Right. It's assumed that you have an idea of what anthrax is. So a client presents to you, what are you going to do? What precautions are you going to take? What assessment might you need to do to confirm that? What's the treatment? Every box is going to look different. However, think about how you would care for or teach whatever the topic is.
Okay.
You know, I think there's seatbelt safety, I think, is one of them. There's a question on HESI about seatbelt safety. I don't know what they're asking, but what would you teach about that? It's a high risk group, right? So think about think about it in clinical terms. Think about it in application terms.
Okay.
And I know it's all over the place. However, those are topic. Every single topic in that HESI prep was asked on the last HESI. I don't know what the question is, but the topic was asked.
Okay, that
helps.
And
that's what I do in my HESI prep is we start thinking about, okay, what do you think they'll ask about anthrax? What do we think they'll ask about SARS? What do we think they'll ask about a WIC? WIC was another one in there. Okay. Does that help?
That helps. Yeah, that helps a lot. Okay.
All right.
Thank you.
And remember, what you put into this HESI study guide is what you're going to get out of it. This is what you're going to be using to study for HESI. Right? So if you take your time and do it kind of the right way, those are the students that do really good on the HESIs. We had a great HESI last term. We were over 83% with PN community.
By doing that packet too?
Yeah, students did really well. A lot of them did this HESI prep all through the term. If you do it at the last minute and just writing in stuff, I don't know how much you're going to get out of it. That's why I give it to you in week 1. You're building your study guide for your final.
Okay.
So
thank you.
Help? Yeah.
Okay. Yeah, that helped.
Okay.
Thank you.
Yeah, you're welcome. Well, I hope everybody has a good weekend. Reach out if you need anything. Okay.
Okay. You too.
All right. Good to
Thank
see
you.
everybody.
Happy
Bye-bye.
Mother's Day to all the moms.
Oh,
Y'all have a great
thanks.
Mother's Day.